Hi, I would like to greet everyone who's listening this topic. We already Monday today, Monday, July 11, 2022. Again, my name is Yanick Dantiste. I am a nurse practitioner, a family nurse practitioner based in West Palm Beach, Florida. So, why I have decided to give some education about health promotion and disease prevention is because of my background. So my background is I've been a registered nurse since 1989. Um, I work in Canada, then I came here in Florida in 1990. And after that, I work at Mount Sinai Medical Center in Miami Beach. I worked there for 15 years. Meanwhile, I went back to school, became a nurse practitioner. So I have my major in family nurse practitioner. Then used to work in peds, and I didn't like peds too much, so I started to work at Mount Sinai, not Mount Sinai, at the VA West Palm Beach since 2002 until now. So I see a lot of things, experience a lot of um, diseases, and the veteran is a sub populations. But believe it or not, whatever we see in the veteran population, we see it in the um, in population in wide. So what I'm saying, veteran has some distinguished illnesses who is really related to them, such as PTSD, which is post traumatic syndrome. Um, some people in the population can have the PTSD, but them their PTSD is really unique because of the war, what they've been seeing. So it's really unique experience. Other than that, all the chronic diseases we see in the veterans, such as diabetic, high blood pressure, hyperlipidemia, high triglyceride, cholesterols, hypothyroidism, infection, heart problem. We see those same chronic disease, we see them in the population at large. So, having said that, whatever I learn, whatever I see in that subpopulation, we can extrapolate that. We can use the same treatment, the same plan of care for other a population. That's for that reason I judge is very important, so I can, um, you know, put my experience to work so I can start teaching the population at large about different diseases, about health promotion and disease prevention. Today, the topic we are going to focus on is the topic will be where are we with COVID-19 pandemic? I have chosen to tackle that subject because when I um, when I walk on the road, when I go to the store, or even though I go to the restaurant, it seems that we don't have no more pandemic. People they are very slack. They don't use mask. Most of the people they don't use normal mask. Um, Again, I'm here to um, educate people who want to. I'm not telling no one how to live their life. According to what I see, according to what I read, I would like to give you some information about where are we with COVID-19 pandemic. Where do we stand with COVID-19 pandemic? Do we still have COVID-19 infection? Yes, we do. Do we still have people who die from COVID-19 infection? Yes, we do. Yes, we still have that. The difference is the main difference is because of the vaccination, people get less sick. Okay, so they don't. We see less hospitalization when people have COVID-19. That's what we've been seeing. This is the main difference, and I contribute that because of the vaccination. Personally, I took my vaccination, and last week I took my first booster. I did the Pfizer, and that went well. I didn't have no. I really don't have no side effect. Really, it's just the site. I took it in my left shoulder, deltoid, just a little bit, so that's it, and everything went well. I took Tylenol before I went to bed, and it was fine. So people still vaccinated, and I think now they are on fourth booster dosage of vaccination, and we have three men uh, for pharmaceutical company who has a COVID-19 vaccine, who distribute that. We have Pfizer, we have Moderna, and we have Johnson and Johnson. So before we start, let's do something fun. Let's have a quote of inspirational quote. Okay. I found that in Facebook, wherever I read something, I just to boost us up. Um, so the inspirational quote for today is, "Life is a journey, not a competition." So we have to keep that in mind. Okay, we are not here to compete with no one. Everybody has their own journey in life. Okay, so life is a journey, not a competition. No one can make you do anything unless you let them. So do not blame nobody. Said that, okay, somebody, someone do that to me. No, no one can make you anything if you don't let them do it. And always remember, life is a journey. And end of quote. So where are we with COVID-19 pandemic? Okay, so let's look at some data, some numbers. Since the first non-COVID-19 cases was identified in the United States, the first case was identified in the US January 21st, 2020. Um, there have been a total of about 85,673 confirmed cases of the coronavirus, or we can say that, um, so we can erase that now. Or we can say in the United States, for every, let's say put it closer, for every 100 people, okay, in the US, for every 100 people, how many cases we have? We have 26,186 infected. So for every 100,000 people, the statistic calculated 26,186 people they are infected with COVID-19 infection. Okay, so if we want to do the math, you can divide it 26,186 divided by 100 multiplied by 100,000. So you will know the percentage of people who is affected. Okay, so also so this is the data. So in Florida, where I am, so okay, in Florida, the infection rate is far higher than the national average. So in Florida, we still have high rate of COVID-19 infection. Um, since the first known cases of COVID-19 was reported in Florida in March. Remember, in the US, the first case was reported January 21st, 2020. And in Florida, it was in March 1st, 2020. So approximately 2 months. Um, there have been 6,407 approximately total infection cases in the state. So for every 100 people in Florida, okay, for every 100 cases, no, for every 100 people in Florida, how many people how many people who is affected? We have 30,084 infected people. Okay, for 100,000 people in Florida, we have 30,000. So it's higher than the national rate. All of 50 states and Washington, D.C., which is make 51, Florida ranks, okay, they are number 8. So for all the 51, the 50 states plus Washington, D.C. So they said just as COVID-19 infection are more concentrated in Florida, so too the death. So the death also is rising. So far, there have been 75,411 COVID-19 related to death in Florida. So that's a lot. And we have for 100 for every 100,000 people, we have 354 deaths in Florida itself. And in the national rate for COVID-19 death is 307 per 100,000 American. So so that's proof that the pandemic is still there. It doesn't go away, even though we see, when we go to the store, when we outside, people just slack, they don't wear their mask. You see crowded sometimes, but it's still there. So I'm going to put this. So this one is, I have the table with me, if we can see that. So let's take the 10 states, the highest state who have high rate of COVID-19 infection. The first one is Rhode Island. Rhode Island has the total cases they have approximately 380,000 cases, and they have total death they have so far, they have 3,603. Alaska, is is the second state. North Dakota is the third one. Kentucky, fourth. Tennessee is the fifth. Utah is the sixth. South Carolina is the seventh. And Florida, as we said before, Florida has is the eighth state. And Florida has total cases of COVID. Um, Florida has uh, per 100 per 100,000 people, Florida has uh, 30,084 people affected. And total death rate, Florida have 75,411. So Florida always been a very slack state about COVID, you know, prevention, whatever. So that's why the rate is high, is still high in Florida. Is it better? Yes, I think it is better, but it's still high. And I'm surprised New York, who was, in the beginning, New York had very high rate COVID cases. Now they are 14. Okay, New Jersey 17, the rank. So they are doing much better than Florida, which is good. So the most important thing also, we need to know what is the sign and symptom when somebody has COVID-19 infection. Okay, when somebody have COVID-19 infection, there's sign and symptoms. So people with COVID-19 have a wide range of symptoms. Okay, ranging from mild symptom to severe uh, illness, which sometimes they need hospitalization. Symptoms may appear 2 to 14 days after exposure to the coronavirus. So that's meaning if you were exposed to that virus, the symptom can come after 2 days. Okay, you have the 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 time lapse is you can have it is between 2 to 14 days, and this is the time also you are infectious. You can um spread it to all the other people, people too. So um this is a time that if you need to isolate yourself. Okay, you don't go to the store, you stay in your room, so you have contact with people less and you wear your mask. Anyone can have mild to severe symptom. Okay, and anyone. So people with this symptom may have COVID. So I'm going to tell you which symptom to look for. Fever, chills. Okay, so most of people with COVID, most of them have fever and chills. This is primary symptom. Cough, coughing, shortness of breath or difficulty to breathe, fatigue. Okay, they feel tired, they feel fatigued, they don't have no strength, they don't have no energies, muscle or body aches. I had I had my second bout of COVID infection. It was, I think, was in March or April. Yeah, I think it was in March or April. And that the muscle and body aches, I couldn't, I didn't feel like walking because all my muscle or my body ache on my body was aching. This is, it's not a good feeling at all. Headache is one of the symptoms also. Last month, my son had, he called me, he told me, Mom, I don't feel good. um, I feel very bad, I have headache, um, I'm vomiting. So all the symptoms he was describing me, it was COVID-19 infection. So I told him, I said, listen, you need to go to the ER, or you need to go to, urgent care and get tested. You need to have to get tested because your symptom is COVID-19 symptom. And sure enough, he went to the ER and he was diagnosed with COVID-19 infection, and they gave him a treatment, and then he went home the same day, and after that he was okay, but he was sick for a couple of days. So um, it's still there. We have symptom, but thanks God he had this vaccination. So the severe the he wasn't that severe. Another, so headache is one. Okay, if somebody have headache, so think about COVID-19 infection. New loss of taste or smell. So that person, they can say, oh, I cannot smell nothing, I cannot taste anything. So that should ring a bell about a COVID-19 infection. Sore throat. Okay, your throat is hurting, you cannot swallow. This is also that congestion or running nose is another sign. Nausea and vomiting, I said it before, and diarrhea. So if somebody have diarrhea, liquid stool, think about COVID-19 infection. So this list is kind of, summarize it for certain symptom, but it can have more, abdominal pain. It can have more symptoms. Somebody can have different symptom than that. But this is the main one we have to remember. Okay, if you or your loved one um, have those symptoms, think about COVID and get tested immediately because they have treatment. Apparently, um, actually, FDA has approved two treatment, so there's a window, of time. So if you are within that window, they can give you that treatment, and the cost of the disease will be much less, and the symptom will be, you will have it less. So again, the symptom or what? Fever or chills. If you have that, or someone have that, think about COVID. Cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion. Your nose, you're congested, you cannot breathe well, running nose, nausea, vomiting, and lastly, diarrhea. This is the sign of symptom. So when to seek medical attention? So when someone should go to the ER? Okay, there is symptom you really need to go to the ER for immediate treatment. So when to seek emergency medical attention is when someone have those symptoms. Somebody has difficulty to breathe, trouble breathing. Um, if you have pulse oximeter is the little machine you can check your O2 saturation by putting it, in your one of your finger, and automatically that will read how much is your oxygen saturation in your blood. So if you have that, and or someone, you have someone who has difficulty breathing, you have that pulse ox machine, use it. And if it's less than 92, that's no good. So that's meaning the oxygenation is not well, into the bloodstream. um, Persistent pain or pressure in the chest, so you need to seek uh, medical attention. So that's meaning that person needs to go to the emergency room, or urgent care. Also, new confusion, that individual was fine, and suddenly that individual is confused. He doesn't know, or she doesn't know where they are. Um, they don't know the month. They don't know where. You can see they are confused. They are not themselves. This is this is a sign. So that person needs to see a doctor immediately. Need to go to the ER. Uh, Inability to wake or stay awake. This is another emergency sign. Need help. Um, Pale gray. The skin color is pale gray or bluish kind. The lips, their lips, and the nail bed, like this one. The nail bed is like blue, pale blue, bluish. And so depending on the skin tone, okay, more pale that person is, it's easier to see it. Okay, um, so this list is not all possible symptom, but if you have those symptoms, this is those symptoms. This is those symptoms you will need to seek emergency medical attention. Okay, again, trouble breathing, persistent pain or pressure in the chest, new confusion, patient become confused, disoriented, uh, inability to wake or stay awake, skin color is pale gray or bluish, and also the lips also can be pale gray bluish, and the nail bed. um, so if someone is showing those kind of symptoms, call 911, or call ahead um, to your local emergency facility. Okay, you can call them and let them know, but the easiest way is to call 911, and the 911, they are very fast, they are coming, and then you can get your uh, emergency medical attention. So also we are also the flu season will be coming soon. Flu season is what, September, October, November. So what is the difference between flu and COVID-19? I really want to distinguish that. Okay, it can mimic the symptom can mimic each other, but it's two different illnesses. So influenza, flu, and COVID-19, they are both contagious respiratory diseases. Okay, they are both contagious. Influenza and COVID-19. Influenza, the flu, each year that cause many deaths as well. Okay, but we have vaccination. People, they are vaccinated every year for flu vaccine. So that's why it doesn't make too much noise, too much noise as COVID-19. But they are causes by, even though they are contagious, but it's different it's different viruses. Okay, they don't come. They are not the same one. So the COVID-19 is caused by infection with uh, uh, coronavirus, first identified in 1919. So this is the first time they identified that in here, in the US. And the flu is caused by infection with influenza viruses. And the flu was it's been there for a long time. Currently, FDA has approved, there's two approved treatments for COVID-19 vaccine. They had before, before we have uh, some um, some treatments for COVID-19 vaccine, but they stop it. The government said no, they don't want it anymore. So, but they have two FDA approved treatment. So, it's approved, people can prescribe it. However, again, as I said, there's a window period. So that's why when someone um when someone think that you have symptom of COVID-19 infection, it's good to seek medical help as soon as you can, because if you are within that window, they can treat you. They can prescribe that and treat you. So, what are the two approved FDA treatment for to approve FDA? So FDA stand by Food Drugs Administration. This is the one who really give the patent, the licensing for the drug company to make their medication. So FDA approved two COVID drug. So two approved FDA COVID-19 drugs or medications, right? So the first one is nematrelvir or ritonavir. And also they call it, for the simple word, Paxlovid. Okay. So the first COVID-19 treatment approved, the FDA approved, the name is nematrelvir, ritonavir, or Paxlovid, is by Pfizer. This one is Pfizer. And the second one, it's Monupiravir. Okay, this is antiviral treatment for COVID-19. It's specifically for COVID-19, those two. So that's why it's important you distinguish the sign of symptom for COVID. So you seek help, immediately go to the ER so they can start you that treatment, which can lessen, um, decrease your time that you're going to be sick. And also you will be less sick also by having those treatment. So I think hopefully that help you a little bit to about the COVID-19, because I'm not here to tell people to wear mask or don't wear mask. I'm not here to tell people to take vaccination or not to take vaccination, take your booster. I'm not here to I'm not no one health a provider. So I'm just here to give you to give you, the education pertinent to COVID-19. The updates of COVID-19. That's why my title was "Where Are We with COVID-19 Pandemic?" Because it seems to me that when I walk, on the street, when I walk on the, in the store, it seems to me there is no more pandemic. It seems to me COVID-19 is gone, but it's not. COVID-19 is still there. People still getting sick. People still getting symptom. However, the symptom is less severe than before because most likely because they got vaccination, and some people they are on their fourth um they are on their fourth booster, COVID-19 booster. I am on my first one. um but yeah, so they still have we still have infection, people still hospitalized. um People still um so let's go back to my son. He last month he went to a party. His friend have a party. Him and his girlfriend went to the you know party. So apparently he told me they had like 15 people. That's what he told me. I just take his word. They had 15 people, and I told him, I said, with that pandemic, why you want to go to part, party like that all the time? And my son doesn't wear a mask. So this is when he got sick. He had fever, he had sore throat, he has headache, nausea, vomiting. So that's why I told him that all those symptoms, they are COVID symptoms, and go and get and go and get tested. And he did get tested, and sure enough, him and his girlfriend, they both had COVID. And then they gave him the Paxlovid. They gave him that, in the ER, and he went home with it, and then he did well after that. Um, so everybody. I mean, I just want people to be um, knowledgeable, to know really what it is, based scientifically, how where we are, because we can see those lists. um as of June 28th, 2022, this is the list that you know we that can prove us people still dying from COVID-19, like in uh, Rhode Island. This is is the higher state who has the more cases and the more death. So in Rhode Island, they have the total COVID death. They have 3,600. All right. So, and we have Alaska. Alaska also, they have, as of June 28th, they have 1,252. North Dakota, they have two 2,294, so on and so on, and so forth. So people, we still have cases, COVID cases. We still have death, okay, per cases, and we still have total death. So it's not gone. COVID-19 infection is still here. People have to be responsible. If somebody is sick, don't visit them. Don't visit them. If you're sick, also you need to quarantine yourself, isolate yourself, stay home, and wear your mask if you're sick. Or if you're not sick, me personally, I wear my mask everywhere I go. I wear my mask. If yeah, I gotta go outside. And also, I don't believe that it's anybody um if it's anybody business also to tell people not to wear or not to wear or not to wear a mask. I know some people, they feel frustrated when they see people with masks. That's their life, that's their health. They want to protect themselves, it's fine. And if you don't want to wear a mask, it's fine too. That's your health, that's your life. You do whatever you think is best for you. My stand, I'm here to give you, the datas, where we are, uh, just knowledge. So the final decision is up to you. It's what you want to do. So again, let's review the symptom again. Okay, we need to know the symptom for COVID-19. It's fever or chills, cough, shortness of breath or difficulty to breathe, fatigue, muscles or body aches, headache. Headache, this is a big one. If especially if you never had headache in your life, let's say you never had a headache, and you started with fever, chills, headache, think twice. Think COVID-19. So get tested, go get tested. Also, new loss of taste and smell. When I had my second bout of COVID-19 infection, I have that symptom. I couldn't smell anything, I couldn't taste the food. So that's why I was sure enough, I knew that I had that infection. Uh, uh, sore throat. Sore throat, it's another symptom for COVID. It could be, it doesn't have to be a COVID. It can be any viral infection can give you that. But if you have fever, you have chills, uh, think 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 about it. Congestion and or not a runny nose, either one. Sometimes you can have both. Nausea and vomiting. And lastly, but not least, is diarrhea. Some people has diarrhea when they are infected with COVID-19 virus. So on that, um, I I hope this topic really make you think a little bit that we only have one health. Okay, we don't have two healths, we only have one health, so we have to to sh- uh, to do the best we can to keep us with an optimal health. you know N- s- to tell you the truth, no one has 100% bill of health, but everybody, we have to strive to have an optimal health. So if we know, what to do, what not to do, that will help. So on that, I will wish you the best of health, and to really to look for the symptom, and to go and seek help immediately. Go get tested. Once you feel that you're not yourself, you feel that you see the symptom, go test it. Don't doubt it or said, okay, I may not have it, I may have it or may not have it. Just test it to make sure, because this way you won't spread it. You won't go and infect it other people. The thing is, you may have it, you're okay, but the other person you are going to infect, that person may have comorbidities, such as diabetic, such as obese, because obese people, they don't do well with COVID-19 infection. Hypertension, or people have kidney disease, transplant people, cancer people. So someone may have that infection, they are doing well or fairly well, but if you don't know you have it, and you're not quarantined or isolated yourself, and you spread it to people who have comorbidities, people who has chronic diseases, you can cause that person to be very, 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 very sick, and we can lead to their death. So that's why it's so important, to be careful, to know your sign and symptom, to seek help as soon as you know, because those treatment, the COVID treatment, the two COVID treatment, there is a time frame. Um, there's a time frame they can prescribe it, because if you let that time frame to go beyond it, that will be um, useless. So that's why. On that, I wish you the best of health. And then next week I'm going to start. Sorry, next week I'm going to um, start with different system. You know, see, different body system and their diseases and the certain symptom what to look and their treatment. Okay. To this weekend, I kind of do something different because I needed to really talk about the COVID-19 infection, because the way I see everybody, most of the people on the street, they are slack. It look like there's that the COVID-19 pandemic is gone. So that's why I wanted to talk a little bit to wake up people up, say, yep, it's not gone, it's still there. People still get sick, people still die from COVID-19 infection. So we need to stay safe. On that, I wish everyone the best of health next time.